Hi, Dr. Barker here at Peak Plastic Surgery. So we get a question a lot of the times that patients come in for any breast procedures is after a breast augmentation, a breast lift, a breast reduction, can I still breastfeed? This is a wonderful question because a lot of the patients that I have in my clinic are still mothers that are expecting to have more children in the future. This question actually comes down to quite a bit of different factors, but the overall answer is yes. You should expect to have a high likelihood of being able to continue to breastfeed if you wish after having a breast procedure of a breast augmentation, a breast lift, or a breast reduction. Where it kind of comes into play a little bit different in the statistics is if we're doing some very complex breast work, is if you hear about breast cancer awareness and having some type of a mastectomy, something like that, that you should not expect to have the ability to breastfeed after because all breast tissue is removed. However, with what I do and here at Peak Plastic Surgery Center, I'm a breast and body cosmetic plastic surgeon specialist. So when I do breast augmentations, breast lifts, combination breast augmentations with a lift, or breast reductions, I really take into account making sure that my patients have the greatest ability to continue with normal life when they're done. So when you look at the statistics, like a breast reduction, overall around 20% risk factor of not being able to breastfeed when you're done. That is on the high end in my anecdotal research within my own practice. Typically, you will have a much higher percent chance of being able to breastfeed and or not being able to breastfeed when you look at the 20%. However, when you look at breast augmentations, when you're doing the technique that I use, I have never had a patient not able to breastfeed afterwards. When you look at breast lifts, I also have not. Breast reductions, because it is a much bigger surgery and much more manipulation of the breast tissue and removal, it should be a higher risk to be unable to breastfeed. But even then, in my personal practice, I'm well above 95% chance of being able to breastfeed. So again, when you're looking at the chances after a breast augmentation, a breast lift, or a breast reduction in terms of being able to breastfeed following surgery, the overwhelming answer is you should be able to when you look at the statistics and the research that has been done within the plastic surgery field. However, the important thing that should be done by each patient is asking their surgeon what technique is used, what is their experience with postoperative complications of being unable to breastfeed, unable to feel their breasts, things of this nature. That needs to be discussed with your particular surgeon. That is something I do with every single patient that comes in and has a consultation with me here at Peak Plastic Surgery Center prior to the surgery. So again, what are the chances that I'm able to continue to breastfeed, or maybe this is your first experience with surgery before children? What are the chances you will be able to breastfeed after a breast augmentation, breast lift, or breast reduction? Again, the overwhelming answer is yes, you should be able to. But again, talk to your surgeon, get informed, get educated so that when you're making these decisions, you can move forward with the utmost responsible and conviction in your decision making as you can, so that you feel comfortable and that you get the results that you're hoping for. If any further questions come up, please let me know.